Hello friends, let's revise pharmacology quickly. So Ruxolitinib is a Janus kinase inhibitor. It is used for treatment in polycythemia vera and myelofibrosis. MF is myelofibrosis. Next one, PCSK9 inhibitor, and this is given subcutaneously, and the drugs are alirocumab and evolucumab and evolucumab. Next one, the drug which is acting on PDE5 inhibitor with PDE6 inhibitor, so both are can be used. So so we have two drugs, vardenafil and sildenafil. Vardenafil and sildenafil can be used for erectile dysfunction, and but it has a side effect of PDE6 inhibition, that is blurred visions and blue green tinting of vision. So eye symptoms are there if there is PDE6 inhibition, blurred vision and blue green tingling of vision. Next one, influenza B. We have disease influenza B, so treatment is pyramivir IV. This drug can be used. This is a neuraminidase inhibitor, so pyramivir IV is can be used for influenza B. This is neuraminidase. Next one, glycopyrrolate. This is quaternary amine compound, and we have three other drugs: atropine, dicyclomine, scopolamine. All these three are tertiary compounds. Next one, prajosin is alpha 1 selective blocker. This is used for treatment, management hypertension and BPH. Okay, next one is glucuronidation. So glucuronidation is in phase 2 biotransformation, and microsomal enzyme is used in glucuronidation. Microsomal enzyme is used. This is phase 2 biotransformation. Okay, next one, this is angiotensin 2. What is this? The action of this, it's increase thirst, release of aldosterone and increase ADH secretion, and it is used for BP in distributive shocks. It is used to increase BP in distributive shocks like septic shock. Okay, next one, vigabatrin. It is a GABA transaminase inhibitor, and tiagabin, it is GABA transporter inhibitor. Okay, next one, codeine. Okay, now codeine is CYP2D6. It is metabolized by CYP2D6 into morphine. So we have some other drugs like diclofenac, morphine, and acetaminophen. It is not metabolized by CYP2D6. So codeine is converted into morphine by 2D6. Okay, mecasermin is recombinant human IGF-1 with its binding protein. Mecasermin, recombinant human IG1 with its binding protein. Next one, lithium. So acute mania, so patient need urgent treatment, so it has 1 to 1.5 milli per liter. This is the therapeutic concentration. Okay, prophylaxis of acute mania. Prophylaxis means somewhat less, so 0.6 to 1 milli per liter. Okay, bipolar disorder, 0.6 to 1 milli per liter. So acute mania will receive high concentration. Okay, side effect of beta 2 agonist. So most common adverse side effect is muscular tremor. Next one is tachycardia. It is due to direct and reflex action both. Next one, inhalation of beta 2. It do not increase free fatty acid. So inhalation of beta 2 agonist, it will not increase free fatty acid. Okay, next one, interleukin 11. It causes what? It is used in severe thrombocytopenia treatment. Okay, and it stimulates hemopoiesis. Interleukin 11, it is used in treatment of severe thrombocytopenia. It stimulates hemopoiesis. Next one, April-Valgin. This is used in treatment of severe thrombocytopenia. So severe thrombocytopenia, April-Valgin. It is used for April-Valgin to treat severe thrombocytopenia. Okay, now bleomycin. The initial side effect is dry cough, most common, and it may cause irreversible pulmonary fibrosis. And PFT cannot diagnose early the toxicity of bleomycin. Next one, natural alkaloid such as sialogogue. Natural alkaloid can be acting as sialogogue is pilocarpine. Pilocarpine is a natural sialogogue alkaloid. Okay, it does what? Muscarinic receptor partial agonist. So its action is muscarinic receptor partial agonist, and it is used in treatment of xerostomia. Okay, bath-rumenical. What? Carbamyl derivative. This is carbamyl derivative. It relaxes urinary tract and treat urinary retention. Okay, next one, once daily dose of beta agonist is indacaterol and olodaterol and vilanterol. So once daily dose beta agonist indacaterol, olodaterol and vilanterol. It is very long acting. Salmeterol and formoterol. It is also long acting, but it is twice daily dose and very long acting. Once more revise: indacaterol, olodaterol, vilanterol. Okay, salbutamol is short acting. Okay, next one, we have ecallantide. It is synthetic plasma kallikrein inhibitor. It is used in acute attacks of hereditary angioneurotic edema. Acute attack of hereditary angioneurotic edema. Okay, next one, TNF alpha inhibitor, infliximab, etanercept, golimumab. Next one, anakinra. It is the 1A, interleukin 1A. What is recombinant type? Recombinant human interleukin 1A. It is used for treatment in rheumatoid arthritis. Next one, phosphines are associated with use of ivabradine. It can be used in heart failure where beta blockers cannot be used. जहाँ बीटा ब्लॉकर नहीं यूज़ हो सकती है आइवाब्राडिन, वहाँ यूज हो सकता है आइवाब्राडिन. Okay, beta blocker is not useful, you can use ivabradine. Okay, next one, calcium channel blocker. It is metabolized by plasmasterase. Calcium channel blocker that is metabolized by plasmasterase is clavitipine. So this is short half-life, is around 2 minutes, and it is used in emergency control of hypertension. Clavitipine. Okay, pilocarpine. So pilocan. Prelocan. It is intermediate amido-amide. It is causing dose-dependent methemoglobinemia. Prelocan. Okay, next one. Alcohol consumption. It is can be acute and chronic. So acutely ingestion of alcohol consumption, it cause CYP2E1 inhibition, and chronic will cause CYP2E1 induction. Okay, next one. Cariprazine. It is atypical antipsychotic, and it is partial agonist activity. It has partial agonist activity of at D2A and at 5-HT2A. And fluphenazine, thioridazine, both are first generation typical antipsychotics. Okay, next one. Sucralfate. Rare side effect is gastric bezoars. Okay. Hypergastrinemia, vitamin B12 deficiency, and increased chance of bone fracture. All these three side effects are use of PPI chronically. So PPI use what? Proton pump inhibitor can cause hypergastrinemia, decrease deficiency vitamin B12, and increased chance bone fracture. Okay, next one. Antitussive with local anesthetic action is benzonatate. Okay, next one. Dextromethorphan. This is centrally acting NMDA receptor antagonist. Okay, next one. Parenteral antiplatelet, that is Cangrelor, and this is used in during PCI, percutaneous coronary intervention. Cangrelor, parenteral antiplatelet. Okay, next one. This is the package. It is almost act like urate oxidase or uricase. What it does, it convert uric acid into allantoin, which is water soluble and inactive. Okay, next one. Gray baby syndrome. This is a premature baby, more susceptible for this one, and there is high mortality is very high, and developmental deficiency of glucuronil transferase is one of the causative factor. Okay, and patient if recovers, there is no complication, recovers without any sequelae or without any complication. Okay, next one. Fungal protein synthesis inhibition. Tavaborole. Sorry, fungal protein inhibition, tavaborole. We have some other drugs, terbinafine, nystatin, and miconazole. All these three are disrupting fungal agrosterols. So friends, please like, subscribe my channel. Thank you.